Hello and welcome everyone to VitalLink's mini clinical conversation with Gail Ritchie. I'm really excited to have a couple minutes of Gail's time to talk about something that's really interesting to us about this pairing between sensory integrative treatment, kind of working from that framework and working from Gail's expertise as an NDT instructor and looking at it from a neurodevelopmental standpoint. So welcome, Gail.
Thank you, Tracy.
So today when we're chatting, I was wondering if you could speak a little bit about kind of how you see and how you view sensory and the motor piece blending together to really enhance your treatment. I know that's something that we have collaborated on at our own clinic with Sheila and with and with you, and working together to use your expertise to really enhance our sessions and to kind of bring that out. And so I was wondering if you could share a little bit about that.
Sure, not a problem. I really do feel that there is a blend between the sensory systems and the neuromuscular systems. And in my experience, what I found as a young therapist is working from an NDT perspective, while I would make my functional outcomes within a treatment session, it seemed that something was missing. And the more I looked at the neuromuscular system, I came to realize that there are the sensory systems that are critical for posture and movement, and working with the sensory systems and the neuromuscular system, you can get more precision in your treatment. So looking at our children that have minimal dysfunction, or our children that are on the spectrum, or children who are up and walking, but there are some things that are amiss, those were the children that were really difficult to get the carryover, if you will. And looking at the properties of the sensory systems and using that in treatment to help with posture and movement was a big bang for your buck. So having the interaction with you and Sheila and trying to help my treatments be more precise, we were having the conversation of how can we use alignment and the neuromuscular system to help your sensory treatments be more precise. Okay.
To my microphone, I completely agree. I think that's been a really beneficial piece, is to add your knowledge in working with the sensory systems. So we have just a little video that we want to share of one of these treatment sessions that you were part of working with one of our clients. So I wonder if maybe we'll watch the video, or if you want to give a little introduction, and then we'll watch the video.
Sure. Jason was a 10-year-old boy who is a lovely young man, who came in for a consult and was having some struggles in school and struggles on the playground. And we did an assessment of Jason. And one of the things that Jason wanted to be able to do was to be on the playground with his friends and be able to climb the monkey bars and swing from the monkey bars. And what we noticed with Jason was that while he was up and had postural control, he had low muscle tone, general low muscle tone. He had excessive hypermobility at his elbows and his low back. And with the postures that he was showing us, with the treatment that we were trying to do, the information wasn't going in like with the precision that I was talking about earlier. So we treated him from an NDT perspective for a little while, and then started introducing more of the alignment piece, getting his center of mass over his base of support, working on timing and sequencing, along with looking at proprioception, the visual system, body awareness, and his vestibular system. So this little video clip is really targeting how we're introducing the sensory systems with the NDT piece as well.
Gail, would you be able to elaborate just a little bit more now that we've seen the video on this specific activity and kind of how you incorporated specific handling techniques? You were using the band. I could see that you were changing the position of not only your body and how you used your hands, but also how you positioned Jason's upper extremities. Could you talk a little bit more about that, how you were using those techniques to really precisely activate his posture and alignment and even respiration?
Absolutely. So we decided to use the Lycra to help Jason get more proprioceptive feedback into his body as he was doing the activity. However, what was happening with the Lycra is his legs were coming into wide ranges of abduction. When he first initiated kicking the ball or hitting the ball with his feet, you saw a lot of lumbar lordosis, using more of what we call his movement system muscles versus his postural muscles. So we changed the tension within the Lycra, within the tube, and to give him more hip flexion, to bring his legs into more adduction, and that helped him sustain the alignment, and then it set up the core muscles to be able to turn on as he did the kicking of the ball. So the first thing that we were struggling with was getting the alignment that he needed in order to get the postural muscles to turn on. So we introduced the handling piece of trying to get him more of that cervical alignment so he could keep his eyes on his feet and on the target, and continue to use the tension of the Lycra to give him the feedback, and the hip flexion to decrease the lumbar hyperextension. So the loading of flexion was to give him the proprioceptive feedback through the cervical spine, his trunk, and his hips. I changed how I was holding his upper extremities to then also generate more of the postural muscles through the thoracic spine, which is through that external rotation abduction of the upper extremities. And I kept changing the position of his upper extremities and got him to hold the Lycra, so then he could feel as he was engaged in the activity, those muscles would give feedback through the proprioceptors into his body. And then getting that active flexion through his abdominal muscles to make the connection of his rib cage to his pelvis. So the key points of control, or where my hands were on his upper extremities in his hand, was to give him that postural setting that he needs for his head over his shoulders over his trunk, and his trunk to his pelvis. And it also helped him to get what we call more selective isolated control of his lower extremities. So he had upper body musculature working with him that let him use his legs in isolation from his upper body, so he could get more of that isolated control of his hips and his lower extremities from his trunk. The Lycra was an adjunct to the therapy that would give him that compression that helped with the alignment, that once again was allowing him to get self-generated muscle activity over well-aligned joints, which continues to give him more precision in that proprioception. The choice of using the ball was to get him eye-foot, so it was to give him the active flexion, but also to get his eyes to target. So keeping his eyes on his feet as the ball was coming at him. It was to give him the timing and the sequencing. And if you think about hanging from monkey bars, you have to use all that lower body, lower abdominal activity to get the flexion. So that activity was simulating what he would have to do on the monkey bars.
Take an activity that is seemingly familiar, something that we use quite often in our clinic, and just making those adjustments, you make it look so effortless, but how you get more power and precision out of the activity so that he can continue to take that into his goal of being able to be more functional on the playground with his peers. So really kind of an interesting little look into it. And I know that Jason will be featured more. This is just a small snapshot in an upcoming course you're doing. Would you mind sharing just a little bit about that course?
That course was it really came out from working with you and Sheila and really trying to figure out how can we get out into the real world, the therapy world, with people who are limited on time and limited on continuing education dollars, that type of thing, about how can we try to help therapists understand the role of the sensory systems as sensory system supports posture and movement, and how posture and movement and alignment can help us from a sensory perspective. And that was really the premise of the course. I'm trying to figure out, when you have these children that have low tone, they have hypermobility, or children that have increased stiffness or cerebral palsy, how can we use the sensory systems along with the musculoskeletal systems to enhance their function?
So much. I know I've seen the course and I've taken it, and I look forward to hearing it again, because each time you say something, it brings a new meaning and a new twist, and I look at my clients in a new way. So I greatly appreciate you sharing your knowledge with us, and look forward to the course. Thanks so much, Gail.
Thanks, Tracy. Have a good day. It was nice chatting.
Take care.
Take care. Bye-bye.
Bye.